Good morning, or good afternoon, wherever you are. My name is John Paul Richard, and I'm going to be talking to you about the outbreak of African swine fever in various parts of Southeast Asia and different markets, and what that could do with bioterror and pandemic outbreak, and how it's a good example of how the world should work together in a better fashion to be more prepared for these sorts of events. Just a few weeks ago, on October 31st, 2019, the Food and Agriculture Organization of the United Nations, also known as the FAO, released an update into the fight in Asia against the outbreak of African swine fever, ASF, throughout the region. Now, for most of you out there, you probably haven't heard of ASF because, for the most part, as to this date, it does not cause any health issues in human beings, and there has been no sign at this time of any crossover infection or infection of new species beyond swine. However, the reality of the effects of this particular disease that it might be having on global health supply and global food supply, and the way that it shows many insecurities that we could have in the health and physical security of some nations, is a very important rallying cry towards defeating this disease, and not just for the purposes of keeping the global price of pork low. Indeed, as I said before, health officials worldwide would be very wise to effectively treat this current outbreak as a trial run for how to deal with the large logistical toll of containing a real pandemic disease that could affect humanity coming in and from Asia. And it's also a very important glimpse into how to secure the food supply of the world at large against any pandemic diseases as a whole that could affect various feed animals. So, as the world begins to deal with the consequences of things like climate change in an actual day-to-day operable way, already atop the myriad of issues that can crop up on consistent logistical basis to deal with food supply, securing the larger food supply against illnesses is a very important step in both mitigating the effect climate change will have and to help ensure the safety of the overall population on a national and international scale. Looking at some statistics, the average adult male in the U.S. consumes more than 64 pounds of pork a year, which is approximately a pound a week on average. And also, pork accounts for 40% of the world's meat consumption. So these statistics just highlight how important this particular product is to the daily diet of many, many people, and how in a very rapidly changing world, due to both disease and climate, it is important to make sure that the availability of this dietary resource has been secured to either continue current consumption levels or to help to transition to another protein-rich resource that could be used in lieu of pork, much in the same way that climate change would revolve around finding a way to secure current supplies of fuel to transition as rapidly as possible to something less damaging. So, what exactly is African swine fever? I'm sure there's a lot of you out there asking, what is this thing? I have not heard of this thing. So ASF is often referred to as the Ebola of pigs, mainly because it has some very similar symptoms. There is no vaccination for this disease. It causes pigs to get extremely sick with flu-like symptoms, and then within a matter of days, they internally hemorrhage until they pass away. Also, and a lot like Ebola, the disease is exceptionally contagious to other animals of the same species. Excuse me. particularly through physical contact. So if a pig or other animal gets sick and something else touches it, the disease that has been found on it will the disease product that is on it will be exceptionally able to transmit to other pigs through any sort of material, matter, etc., etc. Remains on clothes and vehicles for weeks, which then means that despite the original pig being dead, the disease can travel exceptionally long distances or make in a location that has been infected exceptionally difficult to then be sanitized and available to be reused without the disease spreading again. Due to the ability for this disease to last outside of its host physically for weeks at a time, it makes containing this disease particularly difficult. In Asia, the FAO's most recent report highlights a few very, in some ways, terrifying points that I will get to in a bit, as far as the number of pigs killed, which, when one considers the global supply, when you compare them, at first it might not seem so bad when you break it down, but then when you think about it, the numbers being talked about are terrifying. As an example, 10% of the pig population of Mongolia has now been killed. In North Korea, it has spread, but of course, due to various socio-political reasons, it is difficult to get any accurate numbers out of North Korea. In China, the first outbreak of ASF was in Liaoning province, and since that outbreak, at least 1,192,000 pigs have been culled so far, and it is currently projected that up to half of the total population of China's pigs are expected to be killed or culled before the outbreak has ended, and that is over 300 million pigs. That is a quarter of the world's supply. According to the FAO, you're looking at 62,000 dead in the Philippines, 5.7 million in Vietnam, 39,000 in Laos, outbreaks across 5 provinces of Cambodia, 4 outbreaks in farms in Myanmar with unknown specific numbers, and several hundred that are dead in Timor-Leste. So, as we mentioned before, the ability of this disease to last outside of its host for extended periods of time and how easily it is able to spread by contact, those are all difficult problems. But the same thing, one can look at pandemic disease in Africa and Ebola, and it spreads, and it's easy for it to spread. But why is the spread here so much worse and so much quicker than one gets with Ebola? And how rapid can this spread occur? Well, that's mainly because of the ease of transport in the global supply chains that all interlink through Asia. While one can look at the ability of an individual who might be infected with Ebola to travel with relative ease across borders and using, say, airlines to get around the world, the fact still matters that, generally speaking, when somebody is sick with something like Ebola, they are very rapidly noticed and brought to a hospital and are taken care of and isolated as quickly as possible, which does not mean that that it isn't possible for diseases to spread or spread sometimes like wildfire, but generally speaking, one does not look at an outbreak-esque scenario happening the way that it is often indicated in movies. Once the word is out there to look out for things and to be cognizant of physical effects, and once World Health Organization and other officials are aware of what to look for, quarantining is a bit easier. But with animals, if an animal looks or feels sick, one cannot speak to us and say, I feel sick. One often doesn't know that there's a problem with your pork or other food supply due to disease until they start dropping dead, at which point they have already been passing it on and around to many others. So if you look at an infected pig that manages to make it through some quarantine control onto a freighter or train or another vehicle, it can now infect the pigs on that transport, and the disease can sometimes make several trips with different herds to and fro, with infectious material on the actual train or freighter or aircraft, because they are not all as disinfected as they should be, because until now they weren't looking for this sort of pandemic. And now all the previous pigs that were offloaded and moved back and forth on different trips and runs to different places, all of those pigs are now infected due to the fact that the biological material and disease can last outside of the pig for weeks at an end, and etc. And so that's why the ease of this disease to spread is some ways terrifying. So much in the way that one looks at securitization of travel and borders in the event of a human pandemic, so it should be done here. So far, the only thing that's actually preventing the transmission of this disease beyond Asia's borders has been travel time. And thankfully, the fact that this disease kills so rapidly means that it takes too long for the pigs to get to, say, Europe or the United States or South America. They die mid-transit, which then means they are able to be detected and the freighter or ship or whatever can be turned around, and that has been preventing the spread of that pandemic to the actual herd populations of other parts of the world. But that also means that the ease of spread in Southeast Asia has been crazy and wreaking havoc in that region. So looking at this in a grand scheme of things, for what we're talking about today as far as securitization of food supply and being aware of pandemic and things of the like. While it is not currently transmittable to humans, this disease should in some ways be treated as if it were, because of the potential effect on the global food supply and pork production, and because it makes a fantastic sort of lab experiment on how one would deal with a proper global pandemic, especially in the Asian region, with current ease of transport and logistics beyond borders that necessitate global security responses to these major pandemics. It is, in short, the perfect guinea pig, pun intended, for dealing with pandemics and securitization of the health of different markets. And if one were to take this particular issue with pig supply and look at it as an effort to stop a real pandemic that affects humans, it would be a very good way to test response in different areas. So in an effort to move towards eventuality of this securitization, the FAO has made a number of recommendations, both towards governments of the region and in more global efforts on procedures, resources, and security efforts. As an example, the FAO has suggested that animal disease containment in the broadest sense should be prioritized within the highest levels of governments. Preparedness, which could be referring to emergency planning, standard operating procedures, financial support for improved early warning, detection, and notification. Early reaction to the disease and coordination needs to be in place, and it must be reviewed periodically in relation to changing disease situations. There should be an application of some very strict biosecurity measures that are specific to different swine producing sectors, such as there should be frequent cleaning and disinfection of farms, transport vehicles, and production systems. There needs to be better surveillance and monitoring of live pigs as well as pork products after they have been turned into pork product. There should be better communication and coordination with the producing commercial sector and the farms in order to work on cooperation and prevention, detection, and control of the disease. There should be better awareness and training of all stakeholders, from vets to farmers and everyone else in the global chain. Communication of the public should be in place to avoid rumors in regards to food safety perception and the disruption of your ability to consume pork product. There should be better registries on farms for animal identification and having better censuses. There should be proper disposal of food waste, which might contain any uncooked pork product. And after all, if it is uncooked, then the ability of the disease to move is that much worse. And there should be better outbreak control strategies in place. And on a national and intra-regional collaboration sector, there should be better intra-regional networks in regards to disease management, more cooperation on that between different countries working together, and an understanding of the supply chain of different countries, both within the country and through other countries, to understand the risk management of this disease better. And so real quick, some actual efforts that have been made so far by different countries. Again, looking at it through a lens of pandemic, it is interesting to also see how some countries have done a very good job and might then be therefore prepared for proper pandemic, and others not so much. The Republic of Korea, South Korea, has set a buffer zone, which is a 10-kilometer radius around affected farms. So that way, so it separates affected zones from southern free zones and control the traffic of feed vehicles between zones. They have an emergency measure reinforcement plan that's been released, which will include the installation of wide area fence and the use of firearms in buffer zones to drive wild boars away, because this is also an issue with wild boars as that has spread. The ASF virus was detected in pork products at Incheon Airport brought by passengers from Shenyang City, China, just this month on the 6th and 9th of November. And it was detected in a total of 26 confiscated pork products at a port of entry, which again shows that, as terrifying as that might be, that means that pork product has been being inspected, not just while the pigs are alive, but also after death, to make sure that there's no way that waste or other things could manage to help spread the disease. In Vietnam, they have implemented a movement of control of pigs and pig products from affected communes. The Communist Party issued a directive to strengthen leadership and operational instructions for effective responses. In Cambodia, there has been an implementing of a movement control of live pigs, pork, and pork products. In Laos, they have created red areas around outbreaks to control movement of pig and pork products and prohibiting pork consumption in those areas, and yellow areas around the red areas, which are surveillance zones for the government to keep an eye on things. And in the Philippines, they have been implementing a 1710 protocol to manage, control, and contain the spread of the disease. So any pigs within a 1-kilometer radius of any infected farm will be culled. 7 are go under surveillance, and 10 have to submit mandatory reports on the disease. So this all sounds like a lot for what it is at the end of the day, something that for most people will just mean that you may have to shift your diet slowly from one protein-rich meat to another, and that's only if you have to and you find yourself in a, maybe it's a budgetary thing, not because you need to by proxy that there will not be pork. But from the effort that must clearly be brought to bear to work on it by these various organizations, one can't help but look at it and how a human-based pandemic and this should be treated in the same, both for future reasons of human health and global security and for securing the global food supply itself. Because after all, if we as a species are unable to secure our food from disease or fight back in some fashion when we still have the full capability of our many strengths at hand to be brought to bear, how can we possibly achieve real success in the face of an actual pandemic disease that will inevitably arrive with the same potential kill rate, with the same level of communicability, and with the same abilities to cross borders? Let's take this opportunity for this terrible disease, but thankfully that does not affect us in our ability to fight the disease. Let's use this opportunity to strengthen our hand against what will inevitably be coming in a pandemic fashion against us. So that way, at least we're prepared and understand the logistics of dealing with real global pandemic. Worst case scenario, at least we're prepared. Best case scenario, at least we'll still have bacon. Anyway, thank you for listening to me on this. It's been a pleasure talking to you all. Have a great day.